Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Today we're going to do berberine part 3, the antibacterial, antiviral, and glucose management supplement. We're going to talk about two things. One is interactions or adverse reactions, and the other one is absorption. So let's get right into it. Adverse reactions. For some patients, it can create some reflux signs and GI irritation. So it's important to look out for those symptoms. Some people, it can create constipation, nausea, and vomiting at times, and then hypoglycemic events. Hypoglycemia runs in a lot of different patients. So if you take berberine and if it improves insulin sensitivity and decreases blood sugar, your hypoglycemic symptoms may get worse. So with hypoglycemia, what do you feel? You feel lightheaded, dizzy if you miss a meal. If you can get angry if you miss a meal. Or you're that person who goes, I never miss a meal because I don't feel good if I miss a meal. So hypoglycemia is a real phenomenon with blood sugar dysregulation. So it's important to look out for signs and symptoms. The more important one is inhibition of Cytochrome P450 3A4. It's an enzyme found in the liver and the intestines. It helps to break down or oxidize toxins and drugs out of our system. So if this enzyme is affected or inhibited by berberine, right, it's going to affect the metabolism and excretion of toxins and drugs from the body, right? There are other things like St. John's wort, right? Also, metformin can also do the same thing. And other drugs like antibiotics or anti-fungals or certain blood pressure medications can inhibit this enzyme. So it's important to understand what type of drug you're taking and why berberine may interact with it. Now, this is in a very small percentage of patients, right? It really doesn't affect a large portion of these population, but you need to know when you're taking other medications that berberine can have that effect, all right? So the inhibition of metabolism of drugs or toxins, or what we call xenobiotics, is very important. And this is not the only one. There are other enzymes that affect this pathway also. In terms of absorption, right? The clinical studies or studies on rats and mice show the bioavailability of about less than 5%. But why is it so effective, right? Small amounts that even get through can have just a profound effect on sugar regulation as metformin. So even though bioavailability is quite low, the effect is pretty profound in terms of sugar dysregulation and other cardiovascular effects. So why is berberine not bioavailable, not readily absorbed? So berberine is subject to P-Glycoprotein. P-Glycoprotein is an important protein that's found in the cell membrane and that pumps out foreign substances, right? So berberine is affected by P-Glycoprotein. P-Glycoprotein will pump out berberine from the cell. So therefore affecting the absorption or usability or bioavailability of berberine. Now this pump is very energy dependent too, right? It uses a lot of ATP. So in order to excrete these things out of our system, you have to burn more energy, making you more tired at times, right? So what do? It's important to take berberine maybe mid-meal to avoid GI irritation or after meals, okay? And take it with milk thistle because milk thistle will inhibit P-Glycoprotein, right? So that therefore berberine can be more readily available or bioavailable. You can also take it with sodium caprate or capric acid, right, which is found in coconut oil. So what happens is it widens the gap in the intestinal tract, in the cells, right? Paracellular transmission or perfusion or diffusion can occur. So it allows passive diffusion. So if you want to enhance the bioavailability, and you also want to enhance absorption rates, you can use milk thistle and coconut oil or MCT oil. Now, a lot of companies actually come out with berberine with MCT oil, right? And you can also search for sodium caprate or capric acid on our online store. So it's important to understand this. And I get so many questions about, is there adverse reactions, right? Why is the absorption so bad? How does it work? Well, this is how it works. And what you need to do is you need to individualize your treatment protocol. You have to be aware of these things. That's why we say talk to your doctor, because they understand the drug interactions with a lot of different medications, right? Or even your pharmacist. So it's very important for you to do that, all right? My name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. Have an awesome day.